Meyering Center. I'm Angie Hoffman.
And I'm Jill Kinnis.
And I'm going to tell you a little bit about physical intervention techniques. First and foremost, your job is to keep people safe. The individuals that you work with, visitors at the site, and coworkers, and yourself. It's important to remember that all behavior, positive or negative, has communicative intent. If an individual is having a behavior, it's our job to identify what the individual is trying to communicate. It's important to remember that you must attempt to de-escalate or calm the individual before the behavior poses a threat of physical harm to self or others. It's better to be proactive than have to be reactive. Focus on what you can do to prevent these behaviors or these situations from occurring in the first place so you don't have to address it on the backside. If a person's behavior changes or is suddenly or gradually changing, the first thing that you want to do is check for the obvious reasons. Can you think of obvious reasons that you would check for?
Yeah, so the first thing is the environment. Looking to see if there's any new noises or something frightening, or, is there a new roommate that maybe there's something about that added change to the environment. The other thing is just looking at the physical health of the individual. So are they sick? Is there injury, pain? So kind of going back to, the basics of, checking vitals, making sure that, doing a head-to-toe check to make sure there's no signs of injury or pain. And then also just checking the person's mental health to kind of see if there's anything that's upsetting them or triggering them. Maybe it's unhappiness with a situation that happened at work or whatever the case may be.
Once you've ruled out all of those possibilities, then you can use techniques that are taught in therapeutic relationships. Some of those techniques include the calm discussion. Maybe it's just talking one-on-one with the individual to give them that opportunity to have a conversation. You can also suggest an alternative activity, just kind of get them out of what situation they're in, switch their gears, their thinking into a different activity, or offer other options such as spending time alone. Maybe that's just what they need, time away from the scenario or the environment that they're currently in. If an individual has a behavior plan, you want to follow the behavior plan. That plan may include things like teaching an alternative response or skill, improving communication, or building relationships or social skills. Awareness is also very important for prevention. You need to assess the situation quickly, determine what your plan of action would be, and be aware of the individual. If somebody is aggravated, agitated, possibly physically aggressive, you don't want to turn your back on the individual, putting yourself at risk. And then be aware of your surroundings. Do you have an open space to keep your distance from the individual that's becoming aggressive? Are there other individuals in the area that could possibly be in harm's way? And if there is furniture that you could use to put between you and the individual, then that might be something to utilize as well. If a situation were to arise, you should be aware of the other resources that you have. Do you know of any other resources that you could utilize in situations like that?
Yeah, so you could definitely reach out to the on-call person, your program manager for the location, any available coworkers that could be of help in that situation.
Perfect, yeah. If all reasonable attempts have been made to identify the cause and de-escalation has been attempted as well in a non-physical way, and they were unsuccessful, after everything you've tried, if you come to a point where it's unsuccessful, then that's when you may have to rely on physical intervention techniques. One more thing to discuss before we review the techniques is something called positional asphyxia. This is a condition that arises when the body is deprived of oxygen, causing unconsciousness or death by suffocation. Positional asphyxia can occur when restraining a person. This is the reason HMC does not allow certain restraint techniques to be used. We may not restrain a person in prone position or when they are face down. We also may not apply back or chest pressure to someone who is being restrained in supine position, which is face up. Hand placement during restraint is very important. Also, monitoring the individual while restraining them. It's critical that staff be aware of how they are restraining an individual to ensure the individual is not at risk of having their lungs squeezed and to ensure their airway is open. Staff should listen and feel for changes in breathing and respirations. During prolonged restraints, positional asphyxia can occur if the lungs are being squeezed or the airway is being blocked. And this can occur without staff even knowing it's happening until it's too late. This is one reason that restraint should be used as the last resort and in emergency situations only. It's only when a person poses an imminent risk of physical harm to self or others that a manual restraint may be used. It needs to be the least restrictive intervention that would achieve safety. A couple words to cover a little further are manual, which is meaning that we can only use our hands or body in these types of restraints. Imminent, it needs to be an immediate risk. And physical harm to self or others. That means property damage or verbal aggression or a person's refusal to receive or participate in treatment or programming on their own does not constitute an emergency. It has to be emergent, physical harm to self or others, and only manual restraint used. And again, least restrictive. For example, if an individual scratches severely at their face when agitated, restraining their arm or hand is least restrictive than restraining their whole body. Some interventions that are also prohibited would be denying or restricting a person's access to equipment and devices that facilitates a person's functioning, such as their wheelchair. You cannot use chemicals as a restraint. You cannot use mechanical restraints. You are not able to use seclusion or timeout or adversive or deprivation procedures either. And you cannot require a person to earn normal goods and services. They always can have meals. They don't have to earn that. Additionally, all restraints need to stop once the threat is gone. And the use of restraints, even in an emergency, requires documentation and oversight.